Good afternoon. Today we're going to provide an update on COVID-19 community tracing, testing, personal protective equipment, hospital capacity, and an update on the progress around unemployment benefits. Let me talk a little bit to begin about our community tracing collaborative. On April 3rd, our administration announced the creation of this initiative to help mitigate the spread of COVID-19 through contact tracing. Working with Partners in Health, Massachusetts is the first state in the nation to develop this program that will trace confirmed positive individuals for COVID-19. It will also trace their immediate contacts who may have been exposed to this highly contagious virus. We consider this to be a critical effort to not only slow the spread of coronavirus, but to help our Commonwealth return to some semblance of normal life while keeping an eye on where the virus is still present. Through a team of leading medical experts working with the Department of Public Health, this program has already hired 176 employees to do contact tracing through phone calls, and hundreds of additional people are being trained and onboarded in the coming weeks. If you happen to receive a phone call from the Contact Tracing Collaborative, we urge residents to take this call and provide the relevant information. A couple of minutes of your time and cooperation is key in many cases to stopping the spread of coronavirus and saving more lives. It's also key to helping our state build a strategy for how we can get back to something like a new normal. And it's also part of an important effort to protect your loved ones and neighbors. We look forward to growing this program exponentially in the days and weeks ahead. And we appreciate everybody's incredible efforts to build this program and to start to make what will be a very positive impact on our communities in the fight against the virus. Next, I want to provide the latest numbers on testing. Thanks to a lot of hard work by a lot of our partners, Massachusetts remains a leading state in the country in per capita testing. As of yesterday, we conducted a total of 131,023 tests. That includes 5,472 tests that were conducted yesterday. There's no doubt that Massachusetts continues to see an uptick in new cases, tests, and unfortunately, fatalities. Our command center's modeling estimates that the surge in cases would begin somewhere around April 10th, and we expect to see a peak in cases sometime later this month. And as we've said before, these models are obviously predictions and they're all subject to change, but they do provide us and our colleagues in the healthcare community with work that we can then use with our own modeling to determine what, in fact, the best strategy with respect to capacity will be here in the Commonwealth. And it will also help us make sure that we make the best decisions we can to support our healthcare system. At the same time, we continue to work around the clock to ensure that people have the frontline protection and the personal protective gear that they need to be safe. The command centers helped distribute over 3.8 million pieces of PPE so far to hospitals, nursing homes, community health centers, public safety personnel, local boards of health, and state agencies. That includes over 2.2 million gloves, over 850,000 masks, over 370,000 masks from the aircraft delivery, over 180,000 gowns, and 380 ventilators. And yesterday we announced that FEMA will be sending us nearly 1 million pieces of PPE, including masks and Tyvek suits. This shipment is en route and should be arriving in the Commonwealth shortly. And obviously, as I said yesterday, we will continue to chase PPE wherever we can get it. We've obtained and distributed significant amounts so far, but we know we will need to continue to do so because people will need the support today, tomorrow, the next day, next month, and the like. And as a reminder, a daily summary of the PPE distribution is available at mass.gov/COVID-19. The command center continues to monitor hospital capacity. Not only is the command center in constant contact with our hospitals, its medical advisory board includes several experts from the healthcare community here in the Commonwealth. As of the end of the day, Tuesday, there are now a total of about 17,800 beds statewide. And as I said yesterday, just over half of those beds are currently empty. That's about 9,600 beds includes 6,000 acute care beds and about 2,500 ICU beds and about 750 beds that are available through our field hospitals. And that last number, with respect to the field hospitals, will increase as we bring other field hospitals online. We have seen over the past few days an increase in hospitalizations. Medical workers are working around the clock to deal with that influx of patients, and they are keeping up, but every day we continue to see more and more patients in very rough shape come into the hospital. The field hospitals that are currently in place are at the Boston Convention Center and the DCU Center in Worcester, and the three that are coming online, one is in Bourne on the Cape, the second is in Dartmouth on the South Coast, and the third is in Lowell up in the Merrimack Valley. Right now, the number of patients at the two open sites remain relatively low, but those sites are built to augment existing hospital capacity, and we hope the surge is not so significant that it causes us tremendous problems or affects our hospital system's ability to care for people, but we do want to be able to rely on those beds if we need them. As we've said several times here, we are doing what we can to hope for the best, but we are absolutely planning for the worst, and we plan to continue to pay close attention to this data as it comes in every day. I also want to provide an update on unemployment. This morning, the new federal data indicated that over 570,000 Massachusetts residents have applied for unemployment since March 15th. That means approximately 100,000 people applied for unemployment benefits in the last week. I think everybody knows that the number of claims here is eye-popping, given that for months we typically saw somewhere between 7,000 and 10,000 new applications a week. And it represents a variety of workers and businesses that have been impacted by COVID-19 and by many of the decisions that we've had to make in response to COVID-19. And as we've said before, this is about way more than numbers. We all get the fact that there are people behind those claims. There are families who suddenly face economic anxiety after losing a job through no fault of their own, and it's a situation we take extremely seriously. In Massachusetts, we are making progress to get checks out the door. As of today, the Department of Unemployment Assistance is paying unemployment compensation to over 315,000 Massachusetts residents. That's a tripling of the number of people they were paying unemployment compensation to when the month of March began. And as we said before, our online unemployment system is one of the few in the country that didn't crash, thanks to previous work we did to migrate the system to the cloud. And we're improving accessibility to that online system along the way. This past weekend, we launched a new Spanish language online application form, and more languages will be launched shortly. And we're committed to making sure that we help the many people who are having trouble get through the system, get their application processed, and get access to the benefits to which they're entitled. The DUA has dramatically increased its call center staff, turning a center that was 50 workers in the Hurley building about a month ago into an 850-person, as of today, remote call center. As of today, those call center workers have made over 115,000 calls with constituents through that remote call center. I do want to take a minute to thank those call center workers, many of whom have come on board in recent weeks to help us deal with this unprecedented demand. They've been connecting with claimants literally 7 days a week for the past month and are working through the weekends to make sure they connect with everybody who needs our help. The Department of Unemployment Assistance has also held 25 daily virtual town halls in both English and Spanish to guide people through the application process, which as of today have been attended by over 175,000 constituents online. And as of last week, claimants are now receiving the extra $600 on top of their existing benefits thanks to the implementation of the new Federal CARES Act benefit. We're also making progress in our work to build a new technological infrastructure that will allow us to process unemployment claims from workers not traditionally covered by the unemployment system, like the self-employed or gig economy workers. That system is being refined and tested so that we can launch it as soon as possible to get those workers the benefits that they need. We also look forward to sharing more information about that system in the coming days. The progress is not happening as quickly as any of us would like, but things are starting to move in the right direction. And we're going to continue to work this issue hard because we know that for many people, their economic livelihood depends on it. We've talked now for a couple of weeks about the fact that somewhere around the middle of April, we were going to enter the worst part of the pandemic, and that part of the pandemic is here. I know it's difficult for everybody to hear this, particularly given how significantly their lives have been upended over the course of the past 5 weeks. But this virus obviously doesn't work on a schedule. But it can be killed when we all do our jobs to slow the spread. I know it's been a long time, but letting up now would only result in greater harm. All the available data we have shows that people have been staying home and adhering to the guidance that we've implemented to ensure social distancing. We know that's been a significant disruption for everybody, and on some days it probably feels like we've been in this crisis for a lot longer than we actually have been. Please remember to take care of your mental and physical health. If you can take a walk, take a walk. Wear a mask if you go out and take a walk. If you need to go to the store, wear a mask, but go to the store. It's important that people continue to access the pharmacy and the grocery store so that that sort of issue does not become a problem at home. Connect by phone or virtually with your friends and your family. And of course, if you need help, reach out. And remember that this is Massachusetts, and one way or another, we will get through it. We are resilient, and when we stick together, we do meet challenges.